if we're looking at things from a physiologic point of view, I want to optimise the structure from here up. So if you've got a poor head posture, if things are not right, we need to create a good one for you and then support it at that position. So we do some nice stretches of the neck and just decompresses that area. We help to decrease all the muscle tension. We use the tensing to do that. We measure the EMGs. We know with the little electrodes we put on that we're at that neutral position because we can see it. I love objective data. I like facts. I don't want to guess at things. I want to know that I'm heading in the right direction. So when we do that, it's a physiologic approach. Okay, and we look at the posture. Okay, if I took your bite like this, that's how you're going to end up. So we correct this. I don't let the patient sit there with their head like this and take their bite. It's very important that we try and correct that. And then when they wear my appliance at night time, the body says, oh yes, I remember that position. And that allows that decompression to continue all through the night. The TMJs get decompressed. Often people with sleep apnea, it's a craniofacial problem, so that jaw is setting back. It's like the muscle sling. It's back like this. It's squashing everything. You squash something, you cut off the blood supply. So we bring it down, we decompress, and now these, you're getting good blood supply and health happening to the TMJs, etc. So we look at it physiologically. But then on top of that, you have to have an appliance that you can change if it needs to. Okay, so we have what's called titratable appliances. That means that we can test you after you've been wearing the appliance, do a little sleep screening and make sure that your sleep apnea index is coming down, that the number of times you're stopping breathing all night long is reducing, that we're heading in the right direction. But a very common mistake that people make, and even in the medical profession, they just think that the more you push it forward, the further, excuse me, my ugly face there, the more you push it forward, it's going to just keep opening the airway. But we're not mechanical beings, we're physiologic. And when you do something, there will be a reflex reaction to that. So sometimes you can go just that bit too far and there'll be a reflex shutdown of that airway. So it's really critical that you're measuring this. And that's what we do, absolutely. I don't give any titration tools to patients. I'm in charge of that, and I do it based on objective data. So we test it after it's gone in and we know what's going on, and we get them to their sweet spot.